Hello, thank you so much for joining us. Today we're talking about what happens if an abnormality is discovered in your lung cancer screening. We're joined by Dr. John Breard, who is a thoracic surgical oncologist with Banner MD Anderson Cancer Center. Dr. Breard, thank you so much for being here.
Thank you for having me. It's a pleasure.
So let's start with this. If there is an abnormality found, what could that be?
There are many abnormalities that can be found on a lung cancer screening, many of them benign. Some are dangerous to you in ways that don't have to do with cancer, but in general, we're really looking for cancer. Sometimes we find fluid in places it shouldn't be. Sometimes we find vascular abnormalities that need an intervention. But for the most part, we want to find cancers and we want to find them early.
So given what you just said, depending on what the abnormality may be, what is the next step?
Well, if we find a lung nodule, what we do next is based entirely on its size and location. Okay? The smaller nodules, we just follow. You go right back into getting screened in a year. If the nodule's a little bigger, you might get a screening in 6 months, and the larger it gets, maybe you get a PET scan, maybe you get a biopsy.
Now, if cancer is discovered, what type of care can be expected, and are there any advancements in care that you'd like to share?
I would love to. In the unfortunate event that we find a cancer, then it has to be staged. There are two main tenets to staging a lung cancer, and that is looking at the lymph nodes right here and getting a PET scan. If the tumor's big enough or in a location that is at higher risk, you may need an MRI of the brain as well. But once you're adequately staged, then you can get the proper treatment. There are many advancements in both the diagnosis, staging, and treatment of lung cancer. Surgery is minimally invasive now through small incisions, which leads to less blood loss, shorter hospital stay, fewer complications, less pain. And then there's advancements on the medical side with immunotherapy and chemotherapy and directed therapy that has just revolutionized the way lung cancer is treated in the last few years.
Wonderful information. Dr. Breard, thank you so much.
It's been my pleasure.
And thank you for watching. We'll see you again soon.